there. Welcome back to the final segment of today's program, Project Independence and You. We're talking with Dr. Michael Levine, who is a urologist with a local Town of North Hempstead group. And we were talking before, Michael, about how more and more doctors are becoming part of groups and attached to hospitals because it really isn't feasible anymore to practice solo.
Yeah, it's become difficult, and to thrive in today's medical environment, you need to do things better, faster, and less expensively. And when doctors put aside historical differences that they may have personally with each other, there's a lot of good that can come out of it. And you can run your practice more efficiently. You could draw on resources that other physicians can offer you that you didn't necessarily have in your practice when you practiced independently. And it gives the practice a face to the public that you are a unified, integrated group and rely on each other to deliver the necessary health services for their patient, because no doctor can really do it alone. And it's become very difficult to run a practice, keep up with the advances in medicine as a solo practitioner or a small group. And by coming together, you can really offer your patient the best services available. And that's what we've done.
So what's your group called?
We are called Advanced Urology Centers of New York. We have offices throughout Suffolk, Nassau, Queens, Brooklyn, Bronx, Westchester, and offices in Manhattan as well. We have over 40 independent offices that practice together at different locations, and we centralize our education models, our utilization models. We review our quality metrics very, very closely. So the doctors in Suffolk have very, very similar practice patterns to the doctors in the Bronx, and the care that we're delivering is brought to a level that's the best that we can deliver to our patients by reviewing our outcomes and by reviewing our processes and really objectively being open to change to provide the best care possible.
So if someone were to call you to come in and see you, would you remain their doctor, or might they, on the next visit, see one of the other doctors? Or how does that work in your practice?
Most of the physicians in the group can provide most of the services that a patient with a urological problem has. But there are times where someone in the group may have a special level of expertise that not everyone can offer. And we're very happy to move that patient along to a doctor who has more experience within a special area within urology.
Okay, let's talk about women and urology. What do you encounter with older women in your practice?
Interestingly, my practice is comprised of approximately 30% women, which many people find surprising as a urologist. People think that, as a urologist, you're treating a lot of old men with big prostates. And for the most part, that's true. No offense, Jerry. But,
okay.
but there's a lot of women who have urological issues that we need to address, whether it be malignancies of the bladder or the kidney. Kidney stones make up a very big part of my practice in women. Incontinence, many people...
I think like a major issue seems to be urinary tract infections.
Urinary infections are in fact, it's the number one diagnosis seen by urologists when they're treating women. Very, very common.
Why? I think especially as we get older, they become more...
Well, what happens after menopause, the estrogen levels drop, and estrogen is very protective of many bodily functions. It protects good bacteria, so to speak. And when that good bacteria level drops because estrogen levels have dropped after menopause, bad bacteria can overgrow, and it makes you more susceptible to infections as you age. Luckily, these are typically treatable.
Yeah.
They don't progress on to anything more than an occasional nuisance infection. And if treated properly, women can get a lot of relief. But the key is, like you were saying, you need to come in. You need to be aware that treatment is available. I mentioned incontinence, which is a big part of the practice. Many women lose urine when they cough, when they sneeze, when they laugh, and they don't do anything about it because that's how their grandmother or their mother lived. And there's a lot of effective treatment, mostly medical, sometimes surgical, to help with that.
With urinary tract infections, and I almost lost my tract of thought. But the treatment is what, antibiotic?
Typically, it's antibiotics. Sometimes it's changes in the number of in how they manage their bladder. The first thing we do with any woman who comes in is we collect what's called a voiding diary. We want to know how much they're drinking and how often they're getting to the bathroom, and then we can do some very, very simple tests to see if in fact they're emptying their bladder adequately. So if you're not emptying when you think you are and have a puddle of urine left in your bladder, that itself is a setup for infection.
For an infection. And what about hygiene?
Very important. Most people are very clean, but no matter how clean you are, there's a lot of bacteria around the urethra that makes you susceptible for infection. And there's no external part of our body that's sterile. So it's managing risk factors, and aging in women is a risk factor. So for some women, topical estrogen, when appropriate, if they're cleared by their primary or obstetrician to get it, will often help with the problem. Sometimes just going to the bathroom more frequently or focusing on really emptying your bladder is enough. Some people go, they zip up and they're gone, but their bladder is still half full. And if they concentrate on emptying, that'll often take care of the problem.
Okay, another issue that seems to be very common in women is frequency of urination,
Yes.
getting up during that, I guess with men also, once or twice or 3 times. I guess more than that, you're in trouble. You're not
tired.
sleeping, right? What causes that, and how serious is it?
There are many reasons. For men, it's typically the prostate. Sometimes it's as simple as fluid management, where you say to someone who has a voiding diary, who takes a voiding diary, and you'll see on their voiding diary that they drank 12 ounces of coffee or water right before they went to sleep. At any age, you're waking up if you drink that much fluid beforehand. So the first thing to do is make sure that the simple things are addressed. Make sure they're not drinking too much at night. Make sure that if they do need a drink, if they need to take medication, make sure they drink the right fluids. You don't want to have anything that's too sugary or salty, because that produces urine. It causes a diuresis. It causes urine to fill the bladder quickly.
Could I interrupt?
Sure.
You should drink a lot of water every day.
Absolutely.
though.
Everything alive needs water.
You should not drink just so they don't go to the bathroom.
Correct.
No, we're talking about
correct.
it at night,
Yeah.
though.
It-
right
It's a
before you go to
balancing
bed.
act.
Yeah,
And you're
right.
asking why people get up. Beyond the fluid intake, as you age, things change in your body. And many times, older people will notice that their legs get swollen, their feet get swollen at the end of the day. And that's fluid. When you lie in the recumbent position and your feet are now up on the bed, that fluid which is collected in your legs will often drift back into your body as if you're drinking and make you wake to urinate. So I'll see a lot of people and I look at their legs and I'll say, you don't have a urological problem. You need to get on a diuretic to get the fluid off before you go to sleep, so you're not waking to then get it off. And simple things in an exam or a history taking can make a big difference. Often the frequency is a side effect to another problem.
How common is bladder cancer in women?
It's not the most common malignancy, but we see it very, very often. Typically, it's in women who are heavy smokers. Smoking is the first, second, and third risk factor for breast cancer, for bladder cancer. So most women who present with bladder cancer do have a history of smoking. For those who aren't smoking, who don't have a history of smoking, we still see it. They're typically referred in either with gross blood that they see in the urine, or microscopic blood that was picked up on a typical urinalysis that was done at their primary
and the
care.
treatment?
Typically, it's surgical. Most of the bladder cancers, luckily, are low grade, low stage. So simply by looking in the bladder under some very light sedation, we could scrape away the polyp. And if it's a low grade, non-invasive tumor, they're often done when no other treatment is necessary other than a periodic look in the bladder.
So women also should make it their business to see a urologist after a certain age?
I think if they have symptoms that their primary doctor isn't managing well, if they have something like leakage or blood in the urine, those are surefire signs you need to get to a urologist. As just to show up because you've turned 50 or 60 isn't necessary. But when the need to refer is there, it's very important they come and they get examined.
Okay. Well, thank you so much. Jerry, do you have any other questions?
No, I think it's been comprehensive, and you've brought a lot of insights to our listenership. And I know men are concerned with prostate cancer and prostatitis, what have you, but I wasn't aware that there's so many problems that women had.
Very common.
I think people tend to sweep it under the rug and say I have it all the time, or I know I've heard people say I drink cranberry juice and it solves the problem and stuff like that. But, I guess people don't like to talk about these things.
What problem does cranberry juice solve?
I'm not sure if there's any
I've heard that,
good
yeah.
study. I mean, many patients say, I drink cranberry juice and I get better. I say, great. If you like cranberry juice, drink it. It has a lot of calories and a lot of sugar, so that's something they should be mindful of. It may do something with the acidity of the urine. It's certainly not something that I'll ever prescribe as primary treatment, but there's a real placebo effect in a lot of treatments that have a lot of benefits, because if you're dealing with something that really isn't life-threatening and somebody feels better taking that therapy and it's not going to hurt them, I encourage them to do it.
It's a young wives' tale.
Exactly.
Okay. Well, Dr. Michael Levine is going to be preparing an article for our next Project Independence Pioneer newsletter. So if you missed any of the information that he shared with us today, it will be in the article, and the next Pioneer comes out in June. We want to thank Dr. Levine, who, by the way, was chosen as one of Castle Connolly's 2013 top doctors. And Castle Connolly is a rating organization.
Yes.
So that's nice. You're a top doc.
I guess so.
And you're a top performer on the radio.
Right, absolutely wonderful, right.
We appreciate it. Folks, I just want to remind you that we've been told by the New York State Attorney General's office that there is this scam targeting seniors where people call and they say that there's something wrong with your computer, and they say they're calling from Microsoft. Don't believe them. They're looking to get $300 from you and your credit card number. I got a call. I actually got a call. I laughed and hung up. I want to thank, as usual, Dan Cox, Director of Broadcasting, Zach Parker, who's an engineer, Janine Solaro, our fabulous producer, Christina Liu. I want to encourage all of you to listen next week when we have a great show. We're going to be talking about mood foods, Jerry, with a certified dietitian. We're going to have one of our Project Independent social workers with us. Old Time Radio is Duffy's Tavern, where the elite meet to eat. And finally, one of our Project Independence members is going to share some remembrances of her life. So please be sure and be with us. And until then, enjoy life.